everyone. We are the nurses from Far Eastern Memorial Hospital, 6D Ward. Now, we are teaching everyone to perform simple joint exercises. Purpose: to prevent joint contracture and to train muscle strength and endurance of the limbs. It is recommended that all joint movements be performed 3 times a day, morning, noontime, and evening. For each time, 3 sets of exercise should be performed, and each set contains joint movement of 10 to 20 times. If there is any discomfort in the movement, please stop immediately. Pay attention to the pipeline and do not pull it. When performing joint movements, the movement should be gentle and not cause discomfort due to excessive stretching. Do not perform joint movements after joint surgery. Only do so after evaluation by a physician. Shoulder joint exercise. Shoulder lift. Hold the wrist joint with one hand and elbow joint with the other, and then slowly lift the arm. Keep the arm straight with the palm toward the body. External shoulder stretch. Hold the wrist with one hand and elbow with the other. Slowly extend the arm outward. Keep the elbow straight with the palm facing up. External shoulder rotation. Hold the patient's wrist in one hand and the patient's elbow in one hand, and slowly open the patient's arm outward. Bend the elbow at 90 degrees, keeping the patient's body at right angles to the arm. Move the patient's forearm toward the headboard. Internal shoulder rotation. Hold the patient's wrist with one hand and the elbow with the other. Extend the patient's hand until it becomes vertical with the body. Bend the elbow 90 degrees. Slowly move the patient's arm toward mattress. Elbow joint exercise. Hold the patient's wrist joint with one hand and the upper arm with the other. Keep the patient's arm straight with the palm facing up. Bend the patient's elbow. The patient's palm needs to face toward his shoulder. If combined with forearm rotation, this exercise would require rotating the forearm to touch the mattress when the arm is straight during stretching. Wrist joint exercise. Fixate the forearm with one hand and hold the patient's hand into a fist with the other hand. Slowly move the joint forward and backward. If the patient's range of motion is not limited, then rotation can be added. Knuckle exercise. Hold the thumb with one hand and the other 4 fingers with the other. Open up the palm and stay for a few seconds. Repeat the movements above. Hip joint exercises. Hip joint flexion. Knee to chest. Hold the patient's ankle with one hand and knee joint with the other. With the knee joint facing up, bend the leg toward the patient's torso. Then straighten the leg, putting the knee joint down. Side hip exercise. Keep the knee straight with one hand and hold the patient's heel with the other. Slowly pull and stretch the leg outward. Slowly push the leg back. Knee joint exercise. Hold the knee with one hand and heel with the other. Slowly bend the patient's calf to his side until the bottom of the foot touches the bed. Ankle joint exercise. Hold the calf with one hand while the other hand holds the patient's arch. Bend the patient's feet backward toward his body, with the hand at the bottom of the foot. Change the hand to the back of the foot, and bend the foot forward toward the mattress. Toe joint exercise. Fixate the foot with one hand while the other hand gently exercises the patient's toes. Bend the patient's toes backward toward the body. Bend the patient's toes forward toward mattress. Complete the simple joint exercise above. Thank you.